Hello, I'm Dr. Deborah Braboy with Anchored Hope Counseling. Welcome to our YouTube program, Hope Talks. We have some great content provided by our amazing counselors, and we hope that you find it helpful. Hi, and welcome. I'm Dr. Deborah Braboy. I'm here today with Brad Walker. He is a licensed professional counselor at our Anchored Hope Counseling offices. And we just wanted to kind of come today and talk a little bit about what we're noticing that clients are experiencing due to the social distancing and isolating that's happening due to the COVID-19, the coronavirus. So, one thing we have been doing a lot of is just a lot of psychoeducation about self-care and helping people to remember that it's important first to take care of themselves, their mental health, and to have some realistic expectations about what all they can do and within their family. A lot of folks are working from home and their children are home now as well. So they're having to either wrangle kids or homeschool kids. So it's putting a lot of pressure on them. There's a lot of stress. We talked before about just kind of ambiguous loss. We don't really know what to expect during this time. I know some states are kind of going into phase one of trying to reopen the state. And there's a lot of just question about financial security and our economic status, just personally and community-wide and as a nation. So Brad, what are you seeing with some of your clients that you've been working with?
A little bit everything across the board, actually. Interestingly enough, I have some of my clients that this has actually been a blessing for because they deal with a lot of social anxiety. And so the thought of everybody stay at home and stay away from me and leave me alone has actually been a positive in a sense. And so
Yes.
they are actually doing very well with that. Their concerns are when the social distancing and all the things that come with it begin to change and life goes back to whatever normal becomes. They actually have more anxiety about that than they do about what's going on right now. Where I've noticed perhaps some concern with folks is probably financially, unemployment kind of thing, people getting laid off or losing their jobs altogether, kind of thing, and how are we going to make this work long term, and then a lot of frustration with folks that are attempting to find work during this time.
Oh, sure.
And of course nobody's hiring, and so a lot of frustration with that. I've had some of that. And then interestingly enough, I would say almost unanimously my couples that you would think perhaps would be struggling because, if they're having an issue that's bringing them in for therapy, then to take them and lock them up in a home together, without much escape, you would think would actually be like a horrible thing. And they are actually doing very well with this. They've commented about, how they've been able to communicate better and spend more time with one another. I think probably it's helpful that the time they're spending is kind of in the simple things, which is where we kind of start to lose touch as a couple to begin with. It starts the cycle. So I've seen some really promising things out of my clients. They really seem to be doing across the board. They seem to be doing really well, but that's not to say that there aren't concerns. And so again, like I said, I think they're when they think concerns right now, they're thinking more down the road. What's this going to mean when this is over, and what's that going to look
Right.
like? So,
Right. I actually had the same experience with a couple of my clients that you talked about that had social anxiety, and they're really kind of thriving right now. So I do think that's interesting to note. I didn't know others were having that too. I think I'm finding some clients that maybe live alone. And
yeah,
even though they may be more what we would consider introverted, they are really struggling having no connection with
yeah,
other
yeah,
people. Even though some are essential and are still working, they go home and there's no connection with friends or loved ones. And so they're kind of withering a little bit emotionally and mentally, and struggling. So we've looked at creative ways for them to have some connection. Um, and even for older folks that maybe FaceTiming or Zooming or having, virtual connection doesn't really quite meet their needs.
yeah,
Just driving through somewhere and getting a bite and going to someone's house and sitting on the front lawn. The weather's been nice off and on, but if you pick a nice day and can kind of have a picnic and keep your socially, 6 feet apart, your distanced space, still be able to connect and just talk about what's going on maybe outside of coronavirus. But having to be creative, I think it's really making people have to think a little bit harder about how to
yeah,
connect. But yeah.
yeah. As a therapist, a lot of the the um, the barriers that I've run into during this time, by and large, the probably the largest one has been the type of things that you ordinarily would talk to someone about. Let's say, for example, dealing with depression, and so we know that one of the keys to helping a person battle through that is to be active.
Mm,
And so when you think about what your options are now, with so many things being closed,
right.
uh, creative is a great word to use, because uh, the things as a therapist that you would ordinarily think of, when you talk to couples about maybe a date night or a picnic or, whatever. And so much of that
Right.
is so difficult to pull off right now. And, I was just thinking as you were talking, some of the material that I've been looking at the last few days that causes me concern is our senior population.
Exactly.
You think about them being in nursing homes or living alone in their own home, and most of them don't have a lot of the technology that some of us do have that's allowed us
Yeah.
to remain connected as best we can. And so I think they are not only a population at risk virus wise, as we've learned, but probably more so the ones to be concerned about as far as their mental health goes, because they're already,
Hmm.
as we know from the data and the research, they're already at risk for depression and suicide and things like that, because of how lonely they get.
Hmm.
And so certainly my heart goes out to them, because their limits of creativity are pretty small, because
Right.
of the access that they have. So
Right. Yeah. Yeah, and sometimes there's a learning curve with technology. And so sometimes you can go over and show them how to do things and access things, but with that being limited now, send them a link and they're like, what do I do with this?
yes,
We did a kind of a Zoom thing with my kids and grandkids and my mom. We live in about 4 different states between us. For Easter, and that was really nice and kind of lifted her spirits. And so trying to be creative, but you're right. There are some that really just don't even have technology. They don't have smartphones or they don't
yeah,
have computers. And so just being mindful. And I think too, it's really kind of given me a sense of being isolated, what it may be like for them more on the daily basis, having that kind of isolation, that lack of connection. It's given me a little more empathy
yes.
for that. Yeah.
Yes.
And I've had some clients too that are really struggling with these expectations. So they see that some people are, doing home projects and gardening and getting their honeydew list done, and then they're feeling overwhelmed. Like I'm happy to get out of bed and actually put clothes on or wash
Yeah.
my hair today. And so helping to normalize and just giving them permission that it's okay if you don't get things accomplished like that. It's okay if you just keep the little humans alive for the day. It's okay to give yourself permission to have a day for yourself, or to take care of your mental health needs. Take a Calgon moment, whether it be go for a drive by yourself, or lock yourself in the bathroom. I'm reminded of the commercial with the lady with her chocolate in the bathtub, and the kids come and she goes, "It's dad." Just to have some alone time. So even though we're isolated a lot of times with the rest of our family. We don't get away from it. So,
Yeah.
and they're like, I should be grateful for this. And it's like, but it's okay to also feel overwhelmed, and just validating that this is just this whole tangled ball of different things that we feel. We may feel grateful, but we can also feel overwhelmed and exhausted, and fearful, and unsure of what to expect, all of those things. And I think I find myself validating a lot of that in
Yeah.
our therapy sessions.
Well, I think I've seen several things recently, social media wise, speaking to that very issue of how critical it is that we be gracious toward one another, because we may not necessarily land in the same spot in the way that we look at this, and or the activities that we're involved in, and how that we need to be really aware of, that we may not land in the same spot, as our neighbor or whatever, but it's critically important that we be gracious in those moments and understand that where we are is okay, and where they are is okay,
Sure.
and rather than stay in all of this division as a society that we've seen in the last few years, to use this as an opportunity to come together more and understand that we don't all operate the same way,
Mm-hmm.
so and I know that it's, speaking of normalization, I know that for some of these folks that have um, taken the measures that they have to try to protect themselves and others around them, by isolating, some frustration and anger on their part in toward the folks that are not doing that. And so I certainly understand that, because their thought is, well, if these other folks would do what we've all been asked to do, then this would all be over.
Mm-hmm.
Um, but I think we have to be, careful, and again, understand that we're not all going to approach this thing the same way, and that's okay. And that's
And
okay.
that's okay.
Yeah.
Right. Yeah, I'm glad you brought that up. Yeah, people are just handling it differently. We're in Arkansas, and we don't have a shelter in place. And so just being mindful, different people are going to process it differently. And you've just got to do you,
Yeah.
you've got to, make sure you're taking care of you and your family, your loved ones. And instead of judging and having shaming others,
Right.
just kind of
Right.
having a little bit of grace. And I'm glad you brought that up. That's a really good point. Yeah.
Well, I also think about, when you speak of that, I think about some of the folks that we see that are on the front lines, that are that don't have a choice in this.
Mm-hmm.
This is my job, and I have to go do my job, and
Right.
so they have to be, right on the firing line, and they don't have a choice in that matter. So I mean, certainly my hat is tipped to them, not only for the work that they do, but also for the fact that they're kind of judged in a sense, because they're in contact with all these people that are in danger all the time,
Right.
and so
Right.
that's a very weird position for them to be in, because they're frightened just like all the rest of us, but
You're
they
right.
don't
And
have any choice.
I'm glad you mentioned that. I've heard from business owners who say, we're essential. UPS drivers, plumbers, electricians. Some of these people, they still have to work. I mean, they may not be in healthcare, but we still
Right.
need them working, the postal service, things like
Yeah.
that. And so, um, and like I said, business owners have contacted me and they're concerned about their employees. Some of their employees have children at home and they're concerned about them being exposed, being out in the
Mhm.
community. And business owners are wanting to offer services for their employees that have those concerns and fears and anxiety, and I
Yeah.
can applaud that because they've got to support their family. I mean, if they
Yep.
aren't working, and then too, those in the healthcare industry, this is what they were called to do, their passion, they've got training for it, and it's kind of their shining moment. And I certainly would hope we would all kind of support that. And I like that there's stuff even in the media that heroes now aren't athletes or, whatever. And,
Right.
and they're,
Right.
they're really people that are, digging deep and doing the hard work that we need to have done now.
Absolutely. Yeah. Yeah. I was just thinking about concerns moving forward. I was visiting with a lady this morning, and she was telling me about all the different things that they've been doing as a family with their grandson, and just this host of activities, and so I was thinking about, for the kiddos. I mean, when not everything that's come of this is a negative. A lot of it is actually positive. And
Right.
so she was sharing with me, about all these family activities they had done to basically kind of keep their grandson entertained. And I was thinking, okay, so when this is all said and done and it's over, like some of our kids that we've been paying extra attention to and doing a lot of cool things with them, once this is over with and we go back to being,
Mm-hmm.
what we are, and we kind of leave them in the dust, and all those things that they've grown accustomed to having us do over the last several weeks and spending that time.
Right.
And now it's going to go back to the way it was, which means that we're going to be too busy,
Mm-hmm.
to do a lot of these activities that we've done during this virus. So that's also concerning as well.
Yeah, and I've really tried to encourage clients and just friends to, what do they want to take away from this? I mean, let's get some lessons from it. I know I've taken time to get out and walk almost every day, 2 or 3 miles, which I wasn't really doing before. Didn't really fit my schedule, but I know after this is over, I want to try to find a way to still fit that in.
Yeah.
I've been eating a little healthier, haven't been driving through fast food and things. And so certainly, like you talked about, some families having meals together, spending time together, doing activities. So find some things that we can take from this that we want to make sure we incorporate. And it
Yeah.
may be not being so busy. It may be just appreciating that we're having this time, kind of getting back to simpler things.
Yeah.
So, well, as we wrap up, I kind of think that's a good kind of note to tie a bow on it. I like to think, and I'd like to just encourage folks that if they're struggling to reach out to their loved ones. Just make sure you stay connected in some way. If you are struggling with your emotional or mental health, connect with a mental health provider, a counselor, somebody that can help you. I have seen an increase in clients that may need antidepressants or medication. And so that's certainly something you want to make sure you address if there's a need for that. But just know that you're not alone. And we're here for you. You've got loved ones that are here for you. And we just are praying for the time when this is all over and we can take the lessons that we've learned from it. And even if we haven't, but we may just be grateful that it's over. Any final words you want to impart with them, Brad?
No, I just, I like the fact that you said reach out, because your local mental health professional therapist may need to contact as much as you do. So
Yes, and we're really looking forward to getting back face to face too.
yes,
We're,
absolutely.
most of us are doing virtual appointments now just out of necessity. So we're looking forward to being back and working with our colleagues in the offices and seeing our clients, and hopefully soon we'll be able to even hug some. So
Yeah.
anyway, we just hope you have a blessed rest of the day, and you ride out the rest of this coronavirus, and stay safe and stay healthy.
Thank you for watching Hope Talks. We hope this information was beneficial for you. Please be sure to check out our other videos, and if you would please like the video and subscribe to our YouTube channel, we would really appreciate it. Thanks so much and have a blessed day.